Hello, I'm Niels van der Donk, and I'm going to summarize here for the IMF, the CARTITUDE-2 study, Cohort B. So the CARTITUDE-2 study is a multi-cohort study in which Cilta-Cel, a BCMA targeting CAR T-cell product, is assessed in patients with in an earlier setting, including those with newly diagnosed disease. At ASCO and EHA, I presented an update on CARTITUDE-2 Cohort B, and in CARTITUDE-2 Cohort B, patients with first relapse could be enrolled. And in this study, early relapse was defined as relapse within 12 months after transplantation, or in those who did not receive autologous stem cell transplantation, relapse within 12 months after starting frontline therapy that included at least an IMiD and a proteasome inhibitor. So in the CARTITUDE-2 Cohort B, we enrolled 19 patients, well, actually 21 patients. 21 patients were apheresed, and 19 patients in the end received the CAR T-cell product. 2 patients were not eligible for the CAR T-cell infusion because of rapid progression and health deterioration. Patients received Cilta-Cel after flu-cy conditioning, as is used in most of the CAR T-cell studies in myeloma. And when we discuss the results, then I think it's very promising that we had a 100% response rate in this high-risk population with early relapse. And this included 90% complete remissions and at least VGPR in 95%. What is also encouraging is that we see a 12-month PFS rate of 90%. And again, all these patients relapsed within 1 year after starting upfront therapy or after transplant. So a 90% response rate, a 90% PFS rate at 12 months is very encouraging. When we look at the toxicity profile, we see hematologic toxicity as expected after CAR T-cell therapy. The majority of the patients had cytokine release syndrome, but this was mostly grade 1 or grade 2, and only 1 patient had a grade 4 CRS. There were some patients with neurotoxicity, in total 26%, but mostly this was grade 1, except for 1 patient who developed a grade 3 movement neurocognitive treatment emergent adverse event, or as we call it sometimes as well, Parkinsonism. And this patient had multiple risk factors for Parkinsonism, for developing Parkinsonism, including a very high tumor load, progression during bridging. He had a grade 4 cytokine release syndrome and massive expansion of the CAR T cells. And today we know these risk factors, and we try to mitigate these risk factors by new management strategies, including effective bridging therapy, including early management of CRS and ICANS. And since the implementation of those mitigation strategies, the incidence of Parkinsonism has decreased from 6% in CARTITUDE-1 to less than 0.5% across the other CARTITUDE studies. So that's important to know. We also briefly presented some PK and PD data. We also showed that cytokines peak among in the patients treated with Cilta-Cel at a median of 13 days after the infusion, and peak IL-6 and peak interferon gamma levels were associated with development of cytokine release syndrome. So a conclusion from CARTITUDE-2 Cohort B, I think we can conclude that in this high-risk early relapse population, Cilta-Cel induced a high response rate with an encouraging PFS of 90% at 12 months. And overall, the efficacy and safety profile of Cilta-Cel in high-risk patients with myeloma who experience early clinical relapse or treatment failure supported the continued exploration of Cilta-Cel in earlier lines of treatment. For example, the CARTITUDE-6 and 5 study are now soon starting or already ongoing, and they will evaluate Cilta-Cel versus standard of care treatment in newly diagnosed patients.